Hi, my name is Amanda and I'm the Parent Education Midwife here at Darren Valley Hospital. I hope you find these videos useful. Today we'll be looking at nappy changing. This is something that you will be doing many times a day, so it's a good idea to know what to expect. Some of you may have never changed a nappy before, but don't worry, after you've done a few, you will be an expert. Before we look at the practical side of this, let's discuss what your baby's poo will look like in the first few days.
Your baby's first poo is called meconium. It's thick, sticky and black. It's different from normal baby poo as it's the result of what your baby has been sipping when they're inside you, mainly amniotic fluid, skin cells, mucus and fine downy hairs. On the first day your baby is born and the day after, expect that your baby will pass at least one of these meconium poos each day. In addition to this, 2 or more wees. On days 3 to 4, you can expect your baby's poo to have now changed to a greeny olive colour and be at least 2 a day. You can expect 3 to 4 wet nappies in these days, and these nappies should be getting heavier. Around day 5, your baby's poo should now be a yellowy mustard colour, and this is really reassuring as it means your baby is digesting milk well. On day 6 and beyond, your baby will pass at least 2 larger yellow poos and at least 6 wet, heavy nappies a day. Some baby girls can have a small amount of bleeding from their vagina, like a mini period, usually around 2 to 3 days old. This is normal and is the result of a drop of hormones that were passed from mum to baby before birth.
Now we know what to expect, let's move on to the practical side of changing a nappy.
Hi, I'm Rebecca and I'm a student midwife, and today I'm going to be showing you how to change your baby's nappy. What you will need: a changing mat, cotton wool and a bowl of water, nappy sack or nappy bucket, nappies reusable or disposable, muslin or washcloth to dry, and a change of clothes in case of leakages. The floor is usually a safe place to change your baby, but it's important that you make sure it's not too cold. It's important to clean your baby fully, whether they have wet themselves or done a poo. If the nappy is dirty, use the front of the nappy to clean off most of the poo. Then, use the cotton pads and plain water to remove the rest. Clean the whole nappy area, making sure you clean inside all of the creases. If you have a little girl, clean her front to back to avoid getting germs into her vagina. Boys should be cleaned around the testicles and penis, and there is no need to pull back their foreskin. If you have time, wait a little before putting a clean nappy onto your baby to let your baby's skin dry. You can use this time to talk to and smile at your baby. This will help with bonding and support the development. But if you're in a rush, pat the nappy area dry. Place the dirty nappy, pads or wipes in a plastic bag or bucket to dispose of them. When you are ready, put a clean nappy on your baby. Release the tabs and fasten over their tummy. It's a good idea to tuck the nappy under the cord to help it dry out. Release the gussets in the legs to ensure that there are no leakages. Make sure the nappy isn't on too tight. If your baby has a nappy explosion, it's useful to know that the vests are designed to be pulled down over your baby to prevent getting any poo near your baby's face. Don't forget to wash your hands.
There's no need to use any products on your baby's skin during the first weeks of life. Plain water is enough for nappy changes and baths. Nappy rash is caused by baby's skin being in contact with wee or poo for a long time. If you change and clean your baby frequently, they shouldn't develop any skin problems. If your baby does develop a nappy rash, a thin layer of barrier cream can be used. Talk to your midwife or pharmacist for recommendations. Shortly after your baby is born, the midwife will clamp your baby's umbilical cord with a plastic clip. She will offer for you or your partner to cut the cord, or she can do it if you prefer. There are no nerves in the cord, so don't worry, it won't hurt your baby. The cord takes about 1 week to dry up and fall off. It's a good idea to keep it clean and dry until then. Do not try to remove the cord yourself. Allow it to dry up and fall off naturally. If you notice reddening or a foul smell coming from the cord area, it is important to let your GP or midwife know. There are two main types of nappy, disposable and reusable, or sometimes called real nappies. Each have their pros and cons. I myself have used both types on both of my daughters. It's completely up to you which type you choose to use with your baby. I'm going to quickly run through both. Disposable nappies are widely available in the shops and in the supermarkets. Newborn disposables often have a handy urine indicator to let you know when your baby has weighed. Disposable nappies work by having a gel inside them which absorbs the urine, so draws the wetness away from your baby's skin. There are many different brands of nappy, and I recommend you try a few out to see which works best for your baby, as every baby is different. A quick tip to get the best deal is to look at the price label on the shelf, and it will state how much one individual nappy costs. Often nappies are on promotion, so it's best to shop around to get the best deal. You'll be using around 200 nappies in the first month. We also have reusable nappies like this one. Like disposables, they come in different sizes and there are many different types. This is an all-in-one nappy which can be used from birth to potty training. The size is adjusted using these poppers. Some people may find these are a little bit too bulky for a newborn, so you can buy littler ones for newborns. Reusable wipes are also available. The initial cost of reusable nappies can be quite a lot, but in the long run it can work out cheaper than buying disposable nappies. It's worth noting that if you're a Bexley resident, then you're entitled to a voucher worth £50 which can be used to buy reusable nappies. Just do a quick internet search for Real Nappies for London voucher. It is worth noting though, it's only to be used on reusable nappies and unfortunately it's not available in Kent. Hope you find this video useful, and if you have any more questions about this or any other topic, please email the Derwent Valley Hospital Parent Education team using the email address listed below.